Hi everyone, this is Dr. Demchenko, and today we are talking about lower back pain again. And this time we will discuss muscular back pain. Where does it come from? Usually it's pain from the fact that the static muscles in the lower back are doing a very poor job. So if you do a static load or stand for a long time or walk or sit for a long time, those muscles cannot cope with the load. They get sore and tired and start to ache. Usually you really want to massage them, stretch them, or just lie down, but the stable solution is to hypercompensate. That is, it's good to get those muscles pumped up so they can cope with normal everyday issues. And we have prepared for you a set of the most effective and easy-to-perform exercises. Michael will help us with demonstration of these exercises. Today we will review the basic exercises that will help you to strengthen your lower back. All situations can be divided into several categories: acute phase, subacute, and chronic. Today we will focus on the latter two. In the subacute phase, your lower back symptoms or discomfort occur quite quickly. That is, you only need to sit, stand, or walk for 15, 20, 30 minutes to cause discomfort. In this case, combined exercises, both lumbar stabilization and strengthening but in a static mode, will do us good. In the chronic phase, when your symptoms occur sufficiently after a long period of time, meaning that you need to sit or stand for several hours in order to induce symptoms. In this case, concentric and static exercises are more suitable for you. The first exercise is called Superman. Starting position is on all fours and using two diagonals, left arm, right leg, and right arm, left leg. Do one diagonal and then the other. In the starting position, our back is neutral. Then we start simultaneously straightening the unequal arm and leg. The lower back bends, straighten slightly. Our goal is to keep our back from bending sideways so that our back is flat on the floor. This exercise is good for strengthening the lower back and stabilizing it by differently loading the left and right sides. Mistake number 1. While performing this exercise, you begin to compensate by pulling the pelvis back, causing it to rotate relative to the axis of the spine. In this case, the back does not receive the normal load. In this case, only the abductor muscles of the supporting leg work. Mistake number 2. Even if the pelvis remains stable, the shoulders must also be at the same level, and if you lack the mobility of the chest area or its extension control, in this case you might overextend in this exercise, and your back extensors will not work to their full potential unless you can extend your chest. The next exercise is called the bear pose. It will be a progression to the previous exercise called Superman. In this position, we are standing on all fours, resting our toes on the floor and lifting our knees so that our shins are parallel to the floor. The back is kept as neutral as possible. In the first variant, we straighten the leg and the toe touches the floor. In the advanced version, we start with you straightening the leg into the plane of the body. In this variation, it is very important to keep the shoulders neutral and not press them into the neck. The back should remain as neutral as possible. The lower back should not sink in too much. The thorax should not bend too much. Mistake number 1. In this variant, you start to lift your pelvis above shoulder level, which does not fully extend the hip joint, and the lower back is not properly loaded. In this case, you should lower your knees a bit closer to the floor. The second typical mistake is when your hips and arms are at angles to each other, so it looks like you are standing in a spreader bar. And a lot of the load goes to the quadriceps and calf muscles. In this case, most of the load is on the legs. So watch the position of your hips. Your thighs should be perpendicular to the floor. As a home variant for static loading of the lower back, the boat exercise will suit you very well. For this exercise, we lie on the stomach, arms stretched outwards, and turn the arms outward so that palms are facing the floor. Your shoulder blades are slightly brought together, and your neck is slightly stretched. Your legs remain straight, and your hips are off the floor. The point of support is on the pelvic bones and on the stomach. The first variant of the progression of boat exercise will be the following modification. We take an ordinary elastic band, put it on your legs just above the knee, arch your back, bring your shoulder blades together, lift your legs, and move them slightly to the side. This will work powerfully on the gluteal muscles. And the second variant of strengthening, when from the same position we bend the legs at the knees and keep them in a retraction. The main mistake is that you bring the shoulder blades into a forward tilt, and the shoulders go to the neck. In this case, your chest stays bent and does not extend at all, and the lower back is overloaded, and the back extensors are not fully loaded. If you work out at a gym, you can strengthen your lower back directly in your training. To do this, we will use the simulator called hyperextension. Despite the name of the machine, there are two typical exercises you can do on it. The first is hip extension, and the second is overextending your back. In order to bend at the hip joints and keep the lower back in a neutral position, we need to adjust the edge of the board so that the hip flexion level runs freely just above this very border. To measure this, you can do a fairly simple thing. When standing, bend your hip and place your open palm at the level of the bend. Lower your foot, and this is the level at which you will measure whether the exerciser is set correctly or not. If there is a margin of no more than 2-3 centimeters, this will help you perform a normal dynamic hip extension. If this edge is somewhere on a platform or on a cushion, then you will not be bending at the hip joints, but at the lower back. And rounding the lower back is not what we want to achieve when strengthening it. If we want to do exactly hyperextension, that is overextension in the lower back, then it will be enough to raise the platform or cushion so that it slightly overlaps the pelvic bones, so that you and I can't lean forward too much and bend at the hip joints. And as you can see, the platform is now just above the wings of the pelvis. And in this position, I can only hold a neutral position or go into overextension. The normal variant of hyperextension is precisely hip extension. This is when muscles of legs are dynamically loaded. The back holds us statically in a neutral position. In this case, range of motion in the low point is limited by the angle at which the lower back bends. The upper point is limited to the angle at which your back and legs converge in one plane. For a static workout, you and I start our movement from a neutral position. So what we do afterwards is like in a boat. We do an outward swing of our arms, we bring our shoulder blades together a little bit and straighten our neck a little bit so that our chest stance is a little bit stretched as well. And in this position we are going to hold. The first variation of the progression will be a static hold in a neutral position. In this case, the arms are lowered, and for weight we can take kettlebells. The next level of progression is when you press the bar to your chest, bring your shoulder blades together slightly, and extend your chest. Bend over at the lower back and stay in this position statically, already with a load. So how will your program work? In this video, you will see two types of exercises. One is for stabilization, which is performed dynamically, and the second one is static loading, which is aimed directly at strengthening the back extensors. Of all the options, you will need to choose one exercise from each type that suits your current level of training. How often will we perform these exercises? They should be performed at least once a day and preferably twice. The total strengthening period usually takes 6 to 12 weeks in order to get consistently good results. If you are in a subacute condition where pain occurs quite quickly when standing or sitting, then you will choose light versions of these very exercises. And you start doing them without counting the repetitions, but simply on a timer. Each exercise is performed for 40 seconds. After that, every subsequent day or two, you add 5, 10 seconds. Eventually, you should do about 2 to 3 minutes of continuous performance in each exercise. If you easily reach this time interval, you should move on to the next level of difficulty of this exercise. And if you are in a chronic condition, that is, when your pain and discomfort occur after a long period of time, for example, after several hours of sitting or standing or walking, in that case, it does not make much sense to choose the easiest variants. Take at least the medium difficulty level and start from there. Do it not from 40 seconds, but from at least 60 seconds. In this case, the time progression is the same. And also, if you work out at the gym, you do the same exercises, but you slightly improve your training program by adding exercises performed on a machine called hyperextension to the beginning of your workout. Performing this exercise is exactly the same as your home exercises. Dr. Demchenko and physical therapist, rehabilitation therapist Michael have been with you. I hope you find these exercises helpful. Subscribe to the channel, suggest new themes for video clips. Bye-bye, everybody.